My name is Cynthia Mohandas. I'm one of the consultants in acute medicine. My main interest is diabetes and endocrinology. I have 7 other colleagues in the department who have various specialty interests, and the department consists of an acute medical unit and an AEC, which is the ambulatory emergency care unit. Welcome to working with us. You will be having loads of acute medical presentations, and it will be a very stimulating learning experience. You have a good consultant support and nursing support with your clerking, with your presentation skills, and with your procedural skills.
Hi, this is Christy, Ward Manager in Acute Medical Unit. This is a 31-bedded unit we've got, and we sort of getting all the poorly patients who needs first 3 days of care. They come here, and we do get a lot of new doctors coming and going. So anytime, if you got any problem, come and see me. That's me, Christy.
Hello, my name is Sharon. I'm the Senior Sister on Ambulatory Emergency Care. The unit is an emergency unit whereby we stream patients either from A&E or emergency GP referrals on a daily basis. We're a very inclusive team on here, very friendly. It's an excellent learning environment for junior doctors to gain discharge skills and planning. Everything is overseen by a consultant and a very supportive team of nurses.
From the cohort of 7 to 8 consultants, we have various specialist interests: diabetes and endocrine, nephrology, aging and health, cardiology, and intensive care. So all these consultants do their own specialist interest on other days, but they offer sessions to AMAU. So there is a weekly timetable circulated, and the trainees know which are the 2 consultants who will be present in AMAU during the day. And there's another consultant who supports the AEC or the ambulatory care unit.
My name's Laura, and I'm a Foundation Year 1 trainee, and I've been working on AMU since April. So my typical day on AMU would consist of, if I do the 8 till 4 shift, then I would come in at 8, I would meet the consultant for the post-take ward round, and we see all the patients that have come in for the last 24 hours that haven't gone to a different ward apart from AMU. So I go around with them in the morning and then do the jobs that come up from the ward round.
Another part of our team come in at 9, and then we start seeing patients individually by ourselves, and afterwards we'll discuss the patients with the consultant, or if necessary the consultant will see them again afterwards. After this is all done, we have a general board meeting with the nurses, as well as the whole of the rest of the medical team at around 11 or 12 p.m. in our room in AMU, and that's where we go through all the patients again to see if there's anything outstanding or any other queries. After that, we go and do our jobs.
We then meet again at 3. We sort of reassess what's happened with the patients and how they've progressed or deteriorated, and what we need to do from there.
There's a number of juniors, so we have FY1, F2, GP trainee and 2 core trainees as well on the unit, as well as a number of trust grade registrars, so there's lots of support on the unit at all times.
You're really lucky on this ward that you go around with the consultant a lot, so you, especially as the most junior doctor on the ward, will not be expected to do anything that is not within your capabilities. The consultant takes you on the ward round, and you can learn from them about management plans, you can learn from them about how they triage patients and who's sick and who's unwell. So this is actually a rotation that's really good for learning. As an FY1, we do 3 different types of shifts. So you either do your ward shift, which is your regular every day, or you do an on-call, which is 9:30 till 9:30, and you come in and you go with the med-reg on-call, and you see the patients that are just coming into A&E. So that's a bit more acute, so you see the patients maybe when they're a bit more unwell, and you kind of form the management plans for them yourself. And then there's a post-take ward round with the consultant during that shift as well, which we attend. And then the other type of shift is where you do a 9 till 9:30 in the evening. You do your normal day job 9 till 5, and then from 5 till 9:30 you cover the wards. So you, with a couple of other senior doctors, you pick up a different bleep, and if any of the nurses have any issues or if anything needs to be done in the evening, in between the day shift leaving and the night shift starting, then you're the doctors that deal with that.
With the medical on-call rota, as an SHO, there are a number of shifts that we kind of cover. So there's the kind of day on-call shift, which involves clerking acute admissions that come through A&E. That's usually from about 9 o'clock from handover to handover in the evening at 9 p.m. There's also twilight clerking shifts that start at about 11 and 12 p.m. respectively, and those kind of are a bit of extra support for the take acute admissions team when it gets a bit busier in the afternoon. There's also the ward cover shift, so that involves kind of coming and doing your normal day job on the ward from 9 to 5, and from 5 onwards you're responsible for most of the medical wards. There's also the night shifts as well, which go from about 9 p.m. from handover to the handover in the morning at 9 a.m. And you'll be either kind of based on the wards looking after any unwell patients that are inpatients, or again seeing acute admissions that come through A&E, clerking them with the support of registrar on call as well.
Foundation Year 1s have teaching 2 hours a week every week throughout the year, no matter what job you're on. In AMU we have teaching that's joint with renal and respiratory, which is an hour a week, which is led by the consultants, occasionally by registrars, going over any acute cardiac, renal and respiratory issues.
On Tuesdays there's the core medical trainee teaching as well, which is in the afternoon where lunch is provided. And in addition to that, we've recently had radiology teaching introduced, which happens once a week with radiology consultants in the library seminar room, where we'll go through interesting scans and cases, and they'll try and teach us how to interpret different types of imaging.
You do get a wide variety of specialists there, so for trainees to learn from them. And for example, I'm a diabetes and endocrine consultant, and I'm very keen to kind of teach the trainees in diabetes and endocrine, and they are more welcome to attend my clinics. And we produced a lot of teaching modules for the trainees. So in like manner, all my other colleagues teach their specialties on the go as well, and they have a dedicated teaching sessions.
There's Grand Round on Thursdays as well, which is kind of a hospital-wide seminar, usually given by different departments about interesting cases or challenges that they've come across, which is always useful to get kind of different aspects on different fields of medicine that we might not be directly involved with on AMU.
There's loads of learning opportunities, and we have lots of audits, quips going on, and people are presented in local, regional and national meetings. This unit is probably the well-supported unit of all the units in the hospital, because the nursing staff are very friendly, the ward managers are friendly, the FY1s do not need to do the list. The list is done by the nurse in charge, and they get very supportive CMTs who are quite experienced, and there's also specialty doctors they can look to. And if they're worried, I think all the consultants are kind of who are working in AMAU are more than happy for them to be asked than not to be asked. And there's also continuous presence, so there's always a consultant present either in AMAU or in AEC, so they are not kind of left unsupervised.
I think this ward is really about being a team player, because everyone has things that they need to do. Everyone will have their little extracurricular things, and there are enough doctors on this ward to cover it even when you have those things going on. And I think if you have a good team and you have a good team bond, then actually everything goes rather swimmingly, and that includes with the nurses and the OTs and the PTs.
The nurses on our wards are very experienced. They're always a source of help if need be. There's obviously the integrated discharge team, which are very helpful in sorting out social aspects of a patient's discharge, so they'll have occupational therapists and physiotherapists as well. There's also the nurse specialists, so we have acute oncology nurses, and we have respiratory nurses, COPD nurses, so they're always around in the hospital if you need help.
It's always a busy unit with a high turnover, so you do get to see a lot of interesting patients, lots of different cases, and I've kind of lots of opportunity to fulfill your curriculum doing kind of practical procedures, lumbar punctures, chest drains, acidic taps, acidic drains, and there's lots of kind of acute emergencies that we will need to deal with on the wards, but kind of always in a supportive environment as well, so you're never too out of your depth.
Because it's quite an acute ward, you find that you have quite good staffing levels, And some days the patients can be not that unwell and you can have quite a pleasant day at work, quite a relaxed pace. But then on the same note, on other days it is a bit more busy and your patients are more acute, but it's a bit more interesting. There's a lot of support here, senior support here.
Yeah, I thoroughly enjoyed it. There's a lot of educational opportunities, so we're encouraged to go to different types of clinics, and there's a lot of opportunity to do practical procedures, so things like lumbar punctures, chest drains, cystic taps, and there's a lot of support as well, so you'll never feel alone or feel like you're left to do something that you're uncomfortable with. There's always the support of consultants and registrars.
We are so happy to have you with us, and we are happy to support you, both in your clinical as well as in a pastoral way. And many of the consultants have great mentorship qualities, because we do understand that it is a acute medical specialty and there could be a lot of stress. People are very, very, caring and supportive as well. So we are looking forward to working with you. Welcome.